As we hit 8:30 and we have a quorum this morning, I think we'll go ahead and get started. So there is official notice of the publication in the Daily Record, and the Open Meetings Act is located on the north wall of the legislative chambers. Let's see, so roll call?
Okay. Wade,
Yes, here.
Festerson,
Here.
McNally, Rogers, Weiss, Jones, Wilkin, King, Espinoza.
Thanks. So can we get an approval of the minutes and vote for the last meeting in December?
So moved?
Second by
Okay. Motion. Okay. Wilkin?
Yes.
Wade?
abstain.
Okay. Jones?
Yes.
Weiss?
Yes.
Espinoza? Festerson?
Yes.
Okay.
So the next is the approval of the action items. Is there any action items that would need to be, or can I get a motion to approve all of them, A through
M.
M, this month together?
Motion to approve?
Second?
Second, okay. So then,
Okay. Festerson?
Yes.
Wilkin?
Yes.
King? Jones?
Yes.
Espinoza?
Yes.
Weiss?
Yes.
Wade?
yes. All right, so a few presentations this month. First one, are we going to do the acknowledgement?
Good morning. I am really excited this morning to honor a community partner who has really been ever present, at least in the time that I have been here and probably much longer. Somebody that has really been instrumental in helping our community stay up to date and informed on accurate information regarding health happening in our community. And so today I'm very pleased to get to honor Julie Anderson from the Omaha World Herald. And I have a resolution here that I'm going to read honoring her. And then we're going to present her with a coin from Douglas County Health Department. Those of you, I think we've done a couple coins here in the past, so it's just a special way for us to be able to honor the people in our community who really help us do a great job in public health. So whereas Julie Anderson has served as a reporter with the Omaha World Herald for 27 years, including 8 years as a dedicated medical reporter, and whereas Ms. Anderson has consistently provided accurate and timely reporting on public health issues within Douglas County, serving as a trusted source of information for the Douglas County Health Department and the community, and whereas throughout the COVID pandemic, Ms. Anderson demonstrated an unwavering commitment to disseminating reliable information, often being the first to contact the Douglas County Health Department for updates and clarification. And whereas Ms. Anderson consistently attends and reports on public health announcements, presentations, and emergencies, diligently gathering in-depth data and information to provide comprehensive coverage to the public. And whereas in a time of widespread misinformation, Ms. Anderson's dedication to accuracy and integrity serves as an invaluable resource, empowering residents to make informed decisions about their health and their well-being. And whereas Ms. Anderson's work embodies the DCHD's values of people first, belonging, and integrity, reflecting a shared commitment to the health and well-being of the community. Now, therefore, be it resolved that the Douglas County Board of Health and Douglas County Health Department hereby commends Julie Anderson for her outstanding contributions to public health journalism and her unwavering dedication to providing accurate, engaging, and timely information to the residents of Douglas County. And be it further resolved that the Douglas County Board and Douglas County Health Department expresses its sincere gratitude for Ms. Anderson's ongoing collaboration with the DCHD and her commitment to improving the well-being of all. Julie, thank you so much.
Yeah. Thank you, Julie.
All right, what's that, comment?
Yeah, and Julie, we'll give you an opportunity to speak if you'd like and address the board if you want to offer a few remarks, but I'll start by saying I've appreciated all your work too. I think I've known you for almost all those 28 years, and that's quite a commitment to your profession and to journalism and to local coverage of not only public health, but healthcare in general, and many other assignments you've had over the years. So that's so important these days, and I think getting more important in the next few years. So we really appreciate your engagement and your work on these things.
Thank you. I very much appreciate that. I very much appreciate this very unexpected and honor from you all, and I want to thank you all for for providing that kind of open information dialogue. I couldn't do this. I couldn't do it without having access to the information, which has become increasingly challenging in the past some years. It used to be able to walk into the police station and just say hi, but it's a different time, it's a different place, and I really value the fact that you folks make that the data available, the information available, are willing to talk with me about what's going on in the community so that I can pass it on to the rest of the folks in the community. So I appreciate that.
Thank you.
Yeah, thanks for those comments. Next, we have a presentation on the Children's Community Benefit Fund.
Okay, there you go.
Thank you.
Well, good morning. My name is Jen Benson. I am the Manager of Community Benefit and Engagement at Children's Nebraska. We're here today to share a little bit more about our Community Benefit Report and some of our work with our implementation strategy plan. I'm joined today by a few of our colleagues. Holly Dingman, who is our Director of Community Health and Advocacy. You'll hear from her a little later. Megan Connolly is our Vice President of Community Health and Advocacy, and Melanie Thornton is our Director of Government Affairs. So thank you for having us all today. This is a slide on our agenda, so we'll walk through our 2023 community benefit expenses. I've got a few stories to share with you from the Community Impact Report, and then Holly will join us to talk about our previous work on our implementation strategy and then what's ahead for us in 2025. Each of the board members has a copy of our community benefit report. You can also access the community benefit report online. The QR code will take you there directly, or you can go to childrensnebraska.org/community benefit, and that will take you to the page where you can actually see many of our publications and our community health work. So we'll start with our community benefit expenses. Community benefit is reported on IRS Tax Form 990, Schedule H. So the expenses are divided into categories that are defined by the IRS, and those then are reported on the Schedule H. So I will summarize those here. Overall, Children's in 2023 had $205.8 million in community benefit expenses. That represents 34% of our operating expenses. 57% of that is broader community health focused, and 43% is uncompensated care. If you look at the chart on the right, the broader community health overall chart, we'll walk through those expenses. A little bit more detail on these can actually be found on the back page of the community benefit report. So if you turn all the way to the back, there's some summaries there as well. For community health improvement, we had about $6.5 million in expenses. Community health improvement is things like the work that the community health and advocacy team does, our school health work, the work that our social work team is doing related to screening needs, our injury prevention team providing car seats and car seat education in the community. This also includes, from the cash and in-kind contribution section of the Schedule H, this also includes grants that Children's Nebraska provides to community organizations, as well as some of our sponsorships that we provide when they align with identified community health needs. The second line there, health professions education at $27.5 million. So that is our continuing medical and nursing education, as well as support for medical schools and residents. In the subsidized care category, the third one down at $4.6 million, this number represents the subsidized care category is hospital services that are provided. They generate revenue, but they typically cost more than they bring in. And so in 2023, we had 2 of those services in this category. We had behavioral health and some of our home health, pieces of our home health department. The next category down is research at $9.4 million. So this represents the investment in research outside of any revenue or grants that we had received in support of the research. And then finally, pediatric access to care. You'll see an asterisk there too. That is included in the cash and in-kind line item in the Schedule H, but that actually is the expense found, it's the expense in the cash and in-kind category, but it represents the expenses beyond revenue for Nebraska Pediatric Providers, and that's the organization that employs our physicians who practice at Children's Nebraska and in our specialty clinics. So that access to care is representative of the support that we can offer the community with the providers that we're able to employ in the specialty division and children's physicians overall. So in total, that broader community health section, it was about $116.5 million. Then the uncompensated care section, the financial assistance represents the free and reduced care to families whose incomes are at or below 400% of the poverty level. So that was $5.4 million in investment. And the unreimbursed Medicaid is the difference in cost of care compared to the amount that Medicaid reimburses. So that came in at $84 million for a total of $89.4 million in 2023. So you might notice that the community impact report that you have in front of you has a new name. Previously, it was called the Community Benefit Report. So one thing I want to note is we actually changed the name for this reporting year. It still reflects our 2023 community benefit data and expenses, but we wanted to be able to expand on some of the significant stories that we could share with you. Some of the items in this book aren't necessarily purely community benefit in that they don't meet the revenue standards of the standards by the IRS, but they still are very impactful stories that we're sharing, that were of the work that we're doing in the community that we wanted to be able to share. The behavioral health projects would be an example of that impact activity. Those were not 2023 expenses necessarily. So 2 stories that I do want to share with you that you'll find more information about in the book. The first one is regarding SDOH screening and responding to those needs. So this has been implemented organization-wide. We have it in hospital and ambulatory settings, as well as well-child visits and emergency visits. This data is from 2023, and you can see that 48% of our positive screening needs were related to transportation, 28% housing, and 24% food. We have 2 social workers who used Unite Nebraska to help connect our patients who are in need to resources, and then those interventions are actually tracked in the electronic medical record. We also have a resource available in the Children's Go app. So the Children's Go app is an app that families, patients, our employees can use to navigate the children's campus, and then they can also access different information within that app. And there is a little button in there that connects them to community resources, and that link takes them directly to the United Way 211 resource hub. So we wanted to be able to connect families in multiple ways to services that they might need. The next story I wanted to highlight is our summer internship, the Pathways to Healthcare program. So this is an internship for high school students who are from demographics where they would be considered underrepresented in medicine. Ages 16 to 19 years old, so they're high school and some early college. They are a really fun group. So they come to us and they spend about 9 weeks in the summer, and they rotate through many different experiences in different departments in the organization. Our team had the chance to meet with them, visit with them this year. What we've heard from this group is that after they've been exposed to some of these unique experiences at the hospital, that they knew they wanted to go into healthcare, but now they know more about the specific area of healthcare they want to practice in, which is really exciting for them. This is just a photo of that group from one of the, it's a very lifelike mannequin from one of the labs that they were in that they had experience with. So that really summarizes my presentation. I'm going to invite Holly Dingman up to share a little bit more about some of our ISP work and our future focus.
Thanks, Jen. Good morning, everyone. Holly Dingman, Director of Community Health and Advocacy. Happy New Year, if I can still say Happy New Year on the 15th of January. Last time Jen and I had the opportunity to present, it was September 2023. We were about halfway through our implementation strategy plan, and now we have closed the 22 to 24 ISP, and I'm here to provide some highlights. There's a lot in each of these boxes, and happy to go deeper if you have questions. So our ISP this last go around was really organized in 3 broad areas of discovery research, education and training, and advocacy. So much in pediatric mental wellness to celebrate over the last 3 years. We launched Project COPE in 2023 to train the state's primary pediatric care providers on mild to moderate mental health conditions in pediatric patients. In a year, we've trained 94 providers. They completed 20 hours, which means 2,000 CME credits were given to those providers, really better equipping those pediatric providers to address our mental health crisis across the state. We participated in a 2-year learning collaborative, nationwide learning collaborative called Zero Suicide with 16 other children's hospitals to implement a framework and strategy so that all of our team members at Children's became champions and were trained on suicide prevention. Flagship effort is our Caring Contacts program. It went from an idea that we developed into an emerging best practice over the course of 4 years. Patients that come to our emergency department are connected with, for suicide ideation, are connected with a social worker, receive monthly handwritten notes for 6 months to continue that support as they go home. We've enrolled over 1,000 patients, and we've had, as of last Friday, 0 death by suicides of those enrolled patients. Only 7% are coming back to the ED for suicide ideation, compared to nationally, that average is closer to 28%. And this year we also embarked on a trauma-informed care training initiative where we plan to train system-wide our team on trauma-informed care. Lots of advancement in access to mental health services, and a special shout out to Jeannie Weiss, our community health strategy leader, who really helped with the efforts to open our behavioral health urgent care in Kearney. That is proving to be a success, offering access to care in central and rural Nebraska. We have families driving 2 hours to access that care. This will be a model, our urgent care model will be a part of our behavioral health and wellness center, which we broke ground this year, and we have plans to open in early 2026. Community Health and Advocacy has continued to work with schools across the metro and across Nebraska. Our relationship with the Nebraska Department of Education and the professional associations, so school social workers, school counselors, psychologists, have helped us in those efforts where we coordinate trainings for schools and ESUs. We've also worked on youth engagement strategies through the Native Youth Gathering and the Youth Empowerment Summit. Regarding our social determinant of health areas, we focused on food security, healthy housing, and financial stability. We took an approach to include our team members this last go around as a key population. Our partnership with Human Resources brought us to assessing our SDOH needs of our team members. We did that twice, had really great response, and found need within our own organization. So we partnered with Work Lab, which formerly Grow Navigator, to bring work-life coach to children's 2 days a week. That's recently expanded to 5 days a week. We hosted our first Bridges Out of Poverty cohort this summer, and that was positively received by team members, so we will continue to bring Bridges Out of Poverty to team members. Our Habitat for Humanity partnership enrolled team members in their Almost Home program. We graduated 13 team members to become mortgage ready in 2024. Our community partnership work focused on working with our pulmonology team and our advanced asthma clinic to reinstate some referrals to Healthy Housing Omaha around housing assessments and remediation. And we also established a partnership with the Mid-America Environmental Health Services Unit, the PACU, and named Dr. Hannah Niebuhr a recognized environmental health physician champion. Both those partnerships with the PACU and Healthy Housing Omaha will be fostered in our next ISP. We intentionally also focused efforts to develop trust with community-based organizations and to be that bridge for our team into community. We hosted 25 community learning tours. We took children's van out, loaded it with team members, went to organizations like Completely Kids and Together Inc. and Heart Ministry Center and Food Bank. We went to the Undesign the Red Line exhibit twice and had a packed house both times. More than 100 team members joined us on those community learning tours, many noting how helpful that was to be in the space of those community organizations where they refer patient families. Our Be Involved program saw quite a growth over the course of the last couple of years. This is our paid volunteer program. We provide 8 hours of volunteer time for team members to volunteer in organizations serving children and families. In 2,300 hours were contributed. That's equivalent to 1 FTE. This last year, we had 2,800, so 1.5 FTE team member time equivalent dedicated to volunteering in the community. And we're also tracking the unique number of team members that are using those Be Involved hours, and we had 600 team members, which is about 15% of our team base volunteer. We surveyed those team members, and 94% said that their own well-being improved by the volunteer activities, and their understanding of community resources. So a triple win, really. We've embarked on a community board engagement project supporting professional development of children's team members that are serving on boards, and especially strategizing those to serve on boards addressing social determinants of health. Our community contributions and community impact grants totaled over $450,000 to community-based organizations, really lifting up strategies and they're supporting their efforts around SDOH. Health equity is embedded into our SDOH efforts, but we intentionally trained our team through the Racial Equity Institute. And a big win for us was to set up our Health Equity Steering Committee, which has arms of patient, family, team member, and community. And this group is a cross-departmental group. We meet monthly, and we're helping to improve policies and practices. So this is where we are currently in developing our next implementation strategy plan. Last month you heard from Megan Connolly the data and the priorities for our next ISP. Access to care, we will continue pediatric mental wellness and a focus on those social drivers of health. As we took the data into the community and we gathered input through our data gallery walks, we will use that input as we develop our ISP. We'll have an internal team, and we're also new members. We're pleased to share that Regional Health Council has invited Children's to participate. And so we will be bringing our draft ISP to the Regional Health Council in March. That ISP is approved and posted in Q2, and then we'll work to implement. We will be launching our 2025 Community Impact Grant Program and looking forward to working with the Regional Health Council to integrate our ISP into the region-wide CHIP. Just a quick note that this work is housed within our Community Health and Advocacy Department. The department commitments are listed up there. 3 of them are the ISP priorities, and our community impact and school health teams. I'm not going to name all of these or go into the specific initiatives, but you can start to see what we're going to be driving into that implementation strategy plan. And I look forward to coming back in a year and telling you more about what has transpired. Quick links to our Community Health Needs Assessment and our impact report, and just really appreciate the time here this morning. Happy to answer any questions.
Hi.
Hi.
What might be an example of research that you have funded?
That's a great question. So we have the Child Health Research Institute, and I could not name a specific research project. I don't know, Jen, or without doing it justice, but CHRI is.
So thank you for your question. That's a good question. There is actually a summary of one of the research projects in the book here. So if you turn to page 5, there's a little story about some work that we are doing on a rural pediatric obesity study. But the Child Health Research Institute is a partnership between the University of Nebraska Medical Center and Children's Nebraska. And so that $9.4 million, is that the number, that you see represented there in the community benefit expense data is part of the investment in the CHRI, that program. Yeah.
Thanks for that presentation as well, and I'm pleased to see that pediatric behavioral health continues to be a focus for children's. It's a natural, I think, and very much needed these days. And I think a game changer in our community, in addition to the new Community Alliance facility, will be the Children's Behavioral Health Center. Do you have any updates on when that'll open?
We are projected to open in January of 2026.
Great.
Yes.
On track, right?
On track.
It's coming out of the ground fast.
Yes.
Good. Thank you.
Thank you for that. Just a couple follow-up. How did you guys recruit the Pathways to Healthcare Leadership Program? What was the process there?
The interns?
Mm-hmm.
Yeah, so we recruit them from different community organizations in town. So they're typically involved in some program like Girls Inc. or oh gosh, I'm not gonna give you all the right names, but they're involved in various youth programs. Boys and Girls Club is one of them. So they're involved in those youth programs, and then they can work to apply for the program at Children's, and then we interview them and choose them, and they work for us for the summer.
And it's like a paid summer internship.
It is, yep.
Awesome. Also, the community learning tours sound fabulous. Like logistically, how did you guys just rally up a bunch of employees who were scheduled to work, and like how does that work?
We try to schedule them out. Sorry, for the community learning tours, we try to give our team members plenty of time, so we schedule them a minimum of 4 to 8 weeks out. But they're during the day, they're condensed usually for an hour, so we try to just be respectful and get the van so it's easy for team members to hop on and minimize the away time. But those were a couple strategies that we used.
Awesome.
Good morning, Mary.
Good morning.
Thank you for your presentation. Question in regards to your volunteer and community service. You mentioned that you reimburse your employees for 8 hours per year. How does your employee have to apply for that pay? Do you guys have to approve the where they volunteer their hours?
So they are given a bank of hours within our record keeping system. So each full-time employee gets 8 hours. They use it just like PTO time, and log it. We don't necessarily check on where employees are using those hours. We operate with a high degree of trust that they're serving where they need to put their volunteer time. We do a lot of effort in organizing volunteer opportunities, and those are highly sought after, and so we know that team members are going to those organized activities. We survey also afterward and collect other information
Great,
of
thank you.
service. Yes.
Just out of curiosity, are your providers included in that, or is it mostly
Yes.
staff?
Yep.
All right, thanks for your presentation today.
Thank you.
Thank you.
So up next, we're doing a division report for the environmental health.
Morning, Eric Bradley, Division Chief, Environmental Health. Started back in late August, so I'm glad to finally be able to speak to all of y'all. I'm just going to give you a short overview of the environmental health programs that our staff work in on a day-to-day basis, along with some accomplishments from last year and some things we hope to do this coming year. So we have 4 environmental health sections. Air quality and sanitation control and sanitary engineering are all supervised by Russ Hayden. Food safety and compliance is supervised by Adam Carlson, and lead poisoning prevention is supervised by Nadia McCracken. I'm going to go into air quality first. This is our air quality staff. So our main program is monitoring. We monitor for particulate matter 2.5 and 10, ozone, nitrogen dioxide, sulfur dioxide, carbon monoxide, and seasonal pollen. You'll see on the map here, these are the 6 locations where we have monitoring equipment. The green one is actually our health department. That is the only location where we monitor for all of these. Most of the other ones are just specific for things that are going around there. We monitor for particulate matter at pretty much every single station, except for, I believe, the red one. That's up by a power plant, so that is sulfur dioxide and ozone at that one. And we also do inspections like in apartments and stuff for indoor air quality and mold as a more of a consultation, not really regulatory. So some accomplishments from last year, EPA Region 7 came up to audit our ozone equipment, and 2 of our ozone monitors, and no violations were found. We replaced two 24-hour filter-based monitors with continuous monitors. Basically, every day we'd have to go out and replace the 24-hour cartridge, analyze it to see what the particulate matter was. Now with the continuous monitors, it's real-time data. We don't have to really do anything but just make sure that it's running properly. We only had 2 air quality exceedances this year, one for PM 2.5 and one for ozone. Both of those exceedances were just barely above the threshold, so our air quality is very good. Upgraded gas analyzers at 2 of our locations. And then staff did a joint presentation with our sanitation staff at our fall Nebraska Environmental Health Conference about GIS, using GIS to improve efficiency and data sharing. So some things for 2025, we joined with some community partners to apply for a grant to basically construct the North Omaha Trail. If we are awarded that, which we hopefully will be hearing later this month, we will receive money to purchase about 12 purple air monitors that we will then set up around that Omaha Trail and kind of keep track of the particulate matter. So we're hoping for that. We had staff that were involved with the committee to kind of help design the City of Omaha's Climate Resiliency Plan, which was passed last month. So we're hoping to be able to work with the city to implement that plan coming up. So this is our sanitation control and sanitary engineering group. Again, Russ Hayden is the supervisor of this one as well. So we do commercial swimming pools, that's permitting and inspecting. We permit residential swimming pools construction, permit drinking and geothermal wells, septic systems, conduct environmental assessments, address nuisance and pest control complaints, and then we also permit domestic animals, but not dogs, cats, or mini pigs. That goes through the Humane Society. So some of our accomplishments, as you heard from Dr. Hughes, the last couple of months, we've been addressing a rat issue at a recycling center in South Omaha. We worked with the owner, his pest control company, and then the community. That recycling center is now completely out of there. The pest control company is still going to be on site, I believe, through March, continuing to do operations. The city is still baiting the sewers there. Just found out last week that the bait they're putting out there in that community is still disappearing when they go out every week, but they did bait a few streets down, and that bait is still there. So we know they're just basically in that area. So the city is going to continue to bait that for us until we are determined that the issue is done. We had no drownings or near drownings in our commercial residential pools this year. We conducted almost 700 commercial pool inspections, reviewed almost 300 plans for construction of residential pools, over 600 complaints for nuisance and pest control, conducted 147 environmental assessments, 50 wells and 78 septic systems were inspected, and we did discover Jamestown Canyon virus in one of our mosquito pools back in May. So we're hoping for this year, hopefully pretty soon, we'll get our drone launched. We are almost at the finish line. We're working with a company right now to get our exemption from the FAA. We believe everything they need. We're just waiting to hear back from them, and then that process will move forward, and hopefully this spring we'll have a celebration and do a launch. We're looking to update our residential pool and our livestock ordinance to the city. We're working right now with .com to start doing online payments for our permits. We're looking at applying through NEHA to get the National Environmental Public Health Internship Program. So we'll have an intern that will share across the Environmental Health Division, but it'll basically be house and sanitation control. We have some things they can help us. We still have a bunch of paper forms we need to digitize. Then we'll give them kind of an overview of what environmental health is, and then we'll work with them to develop a project that they will be doing. This will be about a 400-hour internship. NEHA pays for their food, pays for them to have a place to live, and we get about $1,500 just to cover administrative costs. So it really doesn't cost us anything. And we're also brainstorming right now for this Cultivating Healthy Environment grants through EPA Region 7. This is a rolling grant that's open to spring of 2027. There's 3 tiers. One is to assess environmental issues in our community. The next one is to implement or basically design plans to address those issues. And a third one is to implement those plans. And each tier goes up about $75,000. So we're trying to brainstorm right now for some ideas on that, and then hopefully we'll apply probably for at least the first tier later this year. This is our food safety and compliance. This is the one most everybody knows when you talk about the health department. They think of food inspectors. So we inspect brick and mortar permanent facilities. That's restaurants, grocery stores, gas stations, convenience stores, any place that sells food. Also do childcare facilities and schools, mobile food trucks, temporary events like Junk Stock, the College World Series, farmers markets. During foodborne illness investigations, we go into the facilities that are suspected of being the cause of it and do an environmental assessment to kind of see what could have helped to cause the illness. Also, other complaints that aren't foodborne related, provide resources on our cottage food law, and then also are addressing illegal vendors, which would be maybe like a mobile food truck that's not licensed here in Douglas County, or somebody who is selling food on Facebook Marketplace, or somebody who sets up a pop tent down in the market without us knowing, or even people who make food out of their home and then sell it out of the trunk of their car. It's just kind of a wild west out there with some of these things. So this past year, we conducted over 5,600 inspections. Over 4,100 were routine. Did about 160 follow-ups on those. Almost 400 mobile licensing inspections. That's at the beginning of the year. The mobile trucks, before they operate, have to have a licensing inspection so we can make sure everything's working properly. And we have a special sticker we put on their truck so we know when we see it, we know that they're licensed this year. 940 inspections of temporary events, farmers markets, child care, and our summer feeding program. Almost 400 complaints were investigated, so over one a day, including weekends. We have a food safety and education position. He consulted with 34 food establishments, visited them many times, and responded to 41 interpretation requests. So he's not really regulatory. He is more going out and offering consultation, finding issues that they have, and then working with them to figure out how they can solve that issue so they would be in compliance. And then our staff also responded to the tornado and the flash flood event, conducted shelter assessments, feeding site inspections, assessed food established without power. I believe they looked at about 160 something food establishments from the tornado that were without power, going through and seeing what food could be saved or had to be thrown out. So in 2025, we're looking to implement some new inspection software. We're just about at the demo stage where they've kind of got roughly what we're looking for. So we're looking at that and hopefully get that launched later this summer. We're looking at updating the food ordinance. We had submitted the food ordinance a while back, and it was a complete rewrite of the current ordinance. We weren't really getting much movement on it because it really wasn't like tracking the block out. It was basically a copy, delete, and then copy and put new stuff in. So we've actually pulled that. We've gone back to taking the current ordinance, gone through and struck out a bunch of stuff that hasn't been valid for a couple of decades, marked that out, put some new language in that adopts the state food code by reference, and then put in some stuff we want to do, like food handler certification, certified food protection managers at these locations. And we'll be trying to bring that to the board maybe next month, just to kind of have a conversation, not for a vote, but just a conversation on where we're going with that. That has been, the new version has been sent to the city attorney. That was right around the holidays, so we're, he said I think he has a trial this week, and then he's going to really start digging into it. So hopefully we'll get some movement on that quick. We're currently talking with the University of Nebraska at Lincoln about doing the online food handler certification. They currently do it for Lincoln, Lancaster County. So there's not a big lift on this. They would basically just rebrand it with our stuff, change a few things that we want to focus on. We're also having conversations with .com to basically be able to do the online payments for this program as well. And then at the end of last year, we actually started an internal illegal vendor task force, just our food staff kind of talking about what they've seen, some things we want to do and go around. This year, we want to kind of expand that. We did work with, I think we issued 8 citations for this last year with the police. We have a liaison with, I believe it's the Northeast Omaha Police Precinct. So we have somebody we can call when there's issues. And then we also work with the Southeast Omaha, I believe, that went out with us on some of these to talk to some of these illegal vendors. So this is our lead poisoning prevention program. This one is completely funded through our the EPA with the Superfund site. So the programs we have interior lead dust. That's basically if they've had any soil remediated. We'll go in, kind of do some health education, do some dust sampling, and provide them with a HEPA vacuum. Environmental lead risk assessments. This is when we've been notified of a kid with an elevated blood level. We'll go in and do our stuff there. If anybody lives in a house that was built before 1978 and has a child that's under 7 years old, we'll go in and do an inspection to see if there's any lead issues. We'll go and do clearance inspections for owner-occupied dwellings after all lead work has been done to make sure that everything has been done properly and there is no lead dust left around. And then we do have a grant through Nebraska Health and Human Services for providing test kits for schools and childcare facilities to test for water in their, or lead in their water. So this year, we screened almost 17,000 children for blood, lead in their blood. That was just a little bit above from last year, so that was a good improvement. Almost 300 cases, which is actually down almost 3.7% from last year, which is good. We had no cases that required chelation, so we were happy about that. For our outreach, we talked to almost 25,000 people at 247 events about lead, conducted 290 lead inspections, did 84 interior home visits and provided 84 of those HEPA vacuums, provided lead care 2 analyzers at 2 clinics on our Superfund site. That is basically when they do a capillary test, they can put it in this machine and within 3 minutes we'll have the results. And then staff did presentations at the National Environmental Health Conference, the Nebraska Environmental Health Conference, and at the Omaha Climate Resiliency Summit. So for this year, we want to increase our blood screenings by 5%. Creighton University is going to start screening at daycares this fall, so that should help with that increase. We're currently working with GIS right now on mapping our inspections for internal. So basically we can keep, right now we have several spreadsheets and databases. We have all our stuff across. This will allow us to use GIS to not only internally map where the locations are, but keep track of our cases and all our notes and all that in one spot. And we're even looking at possibly doing a public-facing thing, so the public could actually click on a rental property and see if there was lead work done, when was it done, and what is the current status of that lead, if it's been remediated, if it's still in the process. We are starting to see, instead of just lead paint and lead in water, we are starting to see a lot of lead come from spices and supplements that are being imported to the country. They're being imported legally, it's just the way they're being processed, there is lead and other metals that are getting in that. So we are starting to do some testing of that. We want to start posting those results on our website when we get them. We'll be doing an advertising campaign in the spring and summer about getting your kid tested for lead. And then right now, through our grant with the EPA, we have to lease our lead analyzers, which is a lot more expensive than actually just purchasing them. We have a new grant manager at the EPA, and we've been talking with them, and it looks like we're probably going to be able to purchase the lead analyzers, which is a big amount up front, but over the life of the rest of the next, I think, 5 years of the grant, it's going to save us a lot of money. I think we're spending like $3,000 or $4,000 a month on leasing, where in less than a year we'd have them paid for. So that's kind of our plan there. So any questions?
Eric, is there still, and I'll defer to Dr. Jones, is there still a mandatory requirement that children age 2 be tested for lead? If they're on Medicaid, I think it was okay.
We would like to reach out to our pediatricians, even through the pediatrician associations, to try to get more kids, not just in the Superfund site, but in the county as a whole, get them lead tested, especially with the spices and the supplements that are now starting to impact the child, not just because they're in a home that has lead, and we're missing out on those kids.
I have a few questions.
Yeah.
Sorry, in the back. That's not my name, though. Good morning. Thank you. You've done a lot of great work in 2024 from what you presented, so it's great to see that, and I'm excited about what's to come in 2025. Just from my ignorance, could you explain what PM 2.5 is?
That's the particulate matter, so that's there's 2.5 and 10, so basically 10 would be about that big, it's not to reference something like that, and part 2.5 would be even smaller.
Okay.
That's the ones that can really get down into your lungs and cause damage.
Okay. Thank you. The other question I had was about the North Omaha Trail. You mentioned that there's going to be these purple air monitors if you get the grant, right? I'm just curious, are there other trails in Omaha that have those monitors, or would this be a unique?
We do not have any out right now. These are really more like citizen science, so there are air monitors out there.
Yeah.
And there is a website you can go to that Purple Air puts all this data out there. Mm-hmm. Our stuff would be shared probably on our website, but we could eventually link that Purple Air Monitor site to ours and have all those locations. They're not really regulatory level, but they give you a general idea of what's going on air quality wise related to the particulate matter.
All right. I love citizen science, so good to hear that. You also mentioned about the illegal vendors, which I found interesting. How do you identify the illegal vendors if you're getting the complaint? So I just was curious.
A lot of times it's just when staff happen to be out and about at night, on their own, and they see somebody setting up selling food. Usually it's like a pop tent, which that's usually only at temporary events. And if we know there's not a temporary event going on, then we know they're doing it illegally. Sometimes, yeah, you do get a lot of restaurants will call when people are set up in front of their property or nearby and they see them because that's competition. They're going through all the legal, paying all the money, the fees, and these people are just setting them like that. A lot of it's on social media. People are just doing it, sending it out of their house. So they'll meet you somewhere and give you the food. That's been going on for years. It's just kind of getting out of hand. So that's why we created this task force to kind of help us address a little bit more and then get the police on board to really help us. We're trying to do more education, talk to them first, kind of say, this is what you can come to us, we'll figure out a way to get you legal. But then if we keep seeing them out there, then we will move to a citation.
Yeah. Who would serve on the task force outside of the health department staff?
We're still working on that. We would definitely want the liaisons from the police department on it.
Yeah.
Like I said, we didn't start till right before the holidays, so we've really only had our internal, but we're still trying to figure out the makeup and what we want to do with the task force before we start reaching to the outside partners.
Okay, that makes sense. Last question. You mentioned that there were 2 clinics that received the lead-2 analyzers in Superfund sites. I'm curious which 2 clinics those are.
That I do not know. I don't know if Nadia's on the call. I don't know if she can jump on or we can get that to you.
Okay, yes, that would be great.
So we provided one-to-One World Community Health Clinic in South Omaha and another one to the Nebraska Urban Indian Health Coalition.
Awesome. Do we know if Charles Drew has one?
They do, and the WIC clinics also have those analyzers as well that we've provided.
Awesome. Thank you, Nadia.
Thanks, Nadia.
Pete?
Thanks for that report. It's your division's responsible for a lot of important items there. It's quite expansive and labor intensive, I think. How many employees are involved in your division?
Including me, we have 33.
Okay. And then I appreciate your involvement in the city's climate action plan, and we were pleased to finally get that approved end of last year. And now it's the important step of moving to implementation. Not to put you on the spot, but do you have a thought for me in terms of your perspective, what needs to happen first, what should be a priority in terms of public health?
Dr. Hughes and I had talked about that a couple months ago before it got passed. I'm trying to think of some of the stuff I had sent to her. I know there's some areas where we can definitely assist. I don't know if there's anything particularly that pops out that we would take the lead on per se, but we would definitely be involved, I think, in a lot of different things. Like our food group is more food safety, so I know there was some of the food insecurities and that kind of stuff. But I did come from a health department several health departments ago where we had a food rescue partnership that the health department kind of did. It was basically to keep food waste out of the landfills. Mm-hmm. So that was basically to donate food to all the places that would take the food, make another meal, and then provide it to people that were underserved. But also we would focus on composting, animal feed, anything that would keep it out of the landfill. So that's some stuff like that we could definitely partner with and be involved with. That's one thing that pops in my head. I can't really think of some other things.
Quick too.
The what?
Can I don't know if the mic actually works. There we go. Okay. One of the other things that we actually met with some representatives from the mayor's office, we being Justin Frederick and I, around really preparedness around climate and especially as it pertains to heat events. Something that was in the climate action plan that was written in there was the potential for essentially a climate-focused emergency response coordinator at the city level. And we actually went in to talk to the mayor's office about whether that was a shared role that we could pursue or whether that was something that we could partner with them to fulfill. Essentially because we already do quite a bit of preparedness work, and climate is something that is heavily on our minds and heavily something that we talk about a lot, especially given the past year with the floods and the tornadoes and kind of the increase in events that are coming due to climate change. And so that is one area that we are also, we had a lot of interest when we read the climate action plan and some of the good work that's in there, that it made a lot of sense for us to potentially partner there because we're already doing quite a bit of work in that area.
Mhm. I'll be pleased to partner with you on that and help as well. And I also want to thank Justin and his team for his presentation to our Public Safety Committee just yesterday on those type of issues as well. Thanks.
And I had also seen within our packet that the invoice for licensing for restaurants recently went out. It's, if I recall, is it coming in the next month or so that those are due?
They were
And-
due December 31st, so we
Okay.
are, last I saw, we're at about 80%. So we were running the numbers now to do the late fee. So anybody that comes in now will have to pay that fee plus the late fee on top of it.
Okay.
But we're about where we are normally, I believe, every year, right at that 80% mark at this point.
Got it. And then at what point, is it February or so that you guys start visiting in person with the, I'm just trying to remember.
Adam, you want to jump on and answer that? Oh. Sorry, Jerry's going to come up.
Yeah, that should be March 15th is when we would be going out in person to those establishments.
Right. Thanks, Adam.
I'm sorry, February 15th. I misspoke, February 15th.
So yeah, we are currently at 80% collected. We are issuing the invoices. They're going out in the mail today. There's roughly 400 invoices that are going out for late fees. And then they get 30 days from yesterday when we invoiced, from the date of the invoice, that they have to be paid by. We will start assessing, or kind of around that 13th of February, we'll go through and see who is collected and who hasn't. And at that point, we will create a list of those repeat offenders. They will be at the top of the list as far as going out and closing.
What's the best way to access the climate action plan?
It's on the city's website. If you go to the planning department or City of Omaha, it's pretty easy to find. Climate and Action Resiliency Plan. Yep, thank you.
Thank you, Eric, for the presentation and information. I guess the task force situation, it just kind of is not sitting right with me, so I just wanted to just talk about that a little bit. And maybe there would be an approach of like more education. It sounded like you were going to do some kind of a campaign or awareness, because I feel like people are really struggling right now with the economy, and so making do with whatever skills they have. And I think that there's a lot of misconception about what you can and can't do. And so, yeah, I would just ask like an education approach.
That's what we are doing, yeah. The first time we see him, we talk to him. Actually, there's been one guy, I think, we actually spoke to him 3 or 4 times before we actually went forward with a citation. He just wasn't, he'd go away for a while, then come back. So no, we're trying to educate them. If they have like a mobile truck, it's usually pretty easy. Just get them to come in, apply, we'll do the inspection, and usually they can get them licensed. But for the other ones, especially if they're working out of their home, we just need to educate them that, you know, you need to find a place that meets the requirements of the code. But yeah, we're not issuing citations right away. The police have been pretty straightforward with that, saying, no, we don't want to do that right away. But if you're seeing people reoccurring doing it, then yeah, let us know and they'll issue the citation.
Okay, and yeah, maybe there could be an approach of like, what are opportunities for them if, you know, they like employment opportunities, if you know of any in that industry, that, you know, some kind of a program that could be started to help with that process.
Okay.
Just as an idea.
Thank you.
And also, you mentioned the commercial kitchens. So like if there are a list of commercial kitchens that your team could find or provide some type of resource for them to kind of say, here's a place where you could start, just in case, you know, that helps with them not being on the street setting up a pop-up tent.
Right. Okay, no, we could do that.
There's an organization called No Empty Pots in North Omaha that will provide kitchens for people that are trying to get startup situations going. So a couple other questions. So you said you have 33 staff members, how many are inspectors?
Well, there's,
The food inspectors. And how does that compare to your goal? Are you feel like you're fully staffed?
let me see. You just talking about food, or you talking about?
Food, yeah, specifically.
Yeah, so we got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We've got 11 inspectors plus our supervisor who does go out, especially on the issues where we need to issue a citation. And actually, Rody here is actually our education, so he's not really regulatory, he can go out and do it. Adam had sent me some stuff this morning that this year, in 2024, we actually had 129 more places open than what we had in the previous year, which results in about 175 more inspections. I believe since the last time we hired an actual regulatory inspector in 2018, it's about almost 500 more inspections a year. And we're also enrolled in the voluntary retail food standards, and standard 8 basically says you should have about 300 inspections per inspector. That includes temporaries, summer feeding, everything. So we're well above that. That's one of the things that we redo the food ordinance. There'll be some things in there that we hope would be able to fund possibly another inspector moving down the road, but that's still down the ways. But
You mentioned earlier about the food safety education position. How would somebody reach out or inquire to get support from them if they wanted somebody to come to their location to walk them through?
Just call the food safety health part of the health department, and we'll get you in touch with him and get that going.
And then you're talking about like this upcoming food handlers permit online training. Do you know, does UNL have that in Spanish too?
They do.
They do. Okay.
The goal would be, we would piggyback off of what Lincoln Lancaster has already designed. So we'd have those two options, and then the hope would be we get enough funding from this, and in a year or two we can move and do another language or two to add on to that, and then Lincoln could also piggyback off of that.
Okay.
So the hope would be to get this into as many languages as possible.
Okay. And then my last question was, what did you want to do with the drone if you get it approved?
One of the things is dropping larvicide in areas where we can't really get to for pest control. There's also, let me pull this picture back up here. You can see this picture right here. This was taken with a drone, not ours, but basically if we get complaints of like if a pool doesn't have a fence around it, instead of having to, get on the property, we can go up and kind of see if there is, and this one you can see there is a fence around it, I believe, so it would be in compliance. So there's just some stuff like that. Also, like for when the tornado, there would be some opportunities for us to do some stuff using that after the fact, just kind of seeing. There's some other slides that are at that presentation they did on the GIS thing using the drone where they can basically see some stuff to see if a type of system is looking like it's failing just from the air. So there's a lot of uses for it. It's kind of a tool that's starting to become popular around the country now.
Any other questions?
I don't have a question, I just have a comment. I thought about it. You had mentioned earlier about the lead poisoning and it's showing up in spices and those types of, mostly food. It reminded me of a study that our College of Public Health was doing in partnership with Health Department, excuse me, in the pre-COVID era. And so that might be an opportunity to revisit. We went in for a federal grant to try to do something more county-wide where we could assess spices in specifically the cultural food markets because a lot of their foods or spices and things are imported, and just testing them to make sure that the lead levels weren't too high amongst other things. So that might be an opportunity to bring back and have a partnership with the college. And then that just lightens the load or burden for the work that you would be doing.
No,
so if you're interested, I just wanted to make sure I threw that out there. Yeah.
All right. Well, if there's no other questions, comments, we'll move on to the health director's report.
Thank you.
Thanks, Eric.
Good
Morning again. I know we're running just a little short on time, so I will try to be as brief as possible on my update. Hopefully I won't have to talk as fast as sometimes I do, but wanted to let all of you know that the legislative session has started. That opened, I believe, last week. And then bill introduction is well underway. So bill introduction happens through the 22nd of January this year. So we are watching to see what kinds of bills are being introduced. And then we are planning, we being the directors of health departments across the state, are planning to come together on the 24th of January to sort through and read a lot of the ones that at least seem like they could be priority bills to determine what kinds of things we think that we would like to take a position on, if we want to send people for testimony or write letters or whatever the case may be there. So we're keeping an eye on that. I also wanted to let you know that I have a bill tracker set up. So that will be embedded on your intranet site, your Board of Health site. I don't have it up yet because I just ran out of time to get it up there as I was building out all of the trackers and everything, but that will be available to you. And just so that you know what that looks like, it essentially is bills of possible public health importance. And then it'll be directly linked. You'll be able to click and directly link to the Nebraska Legislature site where you can actually pull up the text of each of those bills if you want to read those more in depth. And then there will be a section, you'll have to scroll over, but there will be a section for you to read any particular activities that have been undertaken based on that. We often also at Douglas County Health Department get requests to give our input on a bill or to take a certain position on a bill. If that happens, I'll note that in the tracker as well. As yet, I believe the only one that we have been approached on that we knew was coming was a bill introduced or that will be introduced by Sarah Howard, and it is in regards to testing for syphilis in pregnant women. So currently the standard is that women get one-time testing for syphilis during pregnancy. Because our rates are so high here, we are actually hoping to change that so that women are tested 3 times during pregnancy, which is actually the recommendation if you're above a certain percentage or a certain rate within a community. And so that's what that legislation hopes to accomplish. I haven't seen it yet, but I know it's coming. And that is one that, especially given our work around syphilis, congenital syphilis, and fetal and infant mortality, we will more than likely want to go ahead and support and provide testimony on that. So just wanted to let you know where things are there. I don't know a lot other than it's going to be a very busy session and it's going to be a long session. And so we're buckled up and ready to go. We had the first half of our accreditation site visit this week. I'm so excited. It was the virtual part of the session, and I have to tell you, our team did such an amazing job. I am so proud of them. It was a pretty intense few hours of questions that came regarding all of the documentation on all of these domains that we had to essentially show that we were meeting the standards on, and it was a really, really awesome thing to watch all of the people in the virtual room chiming in to give input, helping each other. It was just a really great site visit. I think it went very, very well. I have great hopes for the one coming up on the 22nd. So that is when they are actually on site and will be boots on the ground here at Douglas County Health Department. And then the steps after that really are just wait and see. Accreditation, FAB accreditors meet quarterly to essentially go through applications to make their determination. So it might be a little bit before we know whether we've been accredited or not, but we will be very excited to sit and wait and hopefully see that badge come across. Strategic planning continues on its way. We have completed everything up through implementation planning, so we are right now working on scheduling our implementation planning workshop, and that will be coming up probably in the next month and a half. And we're very excited to really get to put the action in those priorities that will be coming out related to that. Our conference room renovation continues on its way as well. It's looking fantastic. We think that it should be done mid-February. We're really excited to have a bigger room so that we're able to actually host community meetings more frequently, so that we have technology that works when we need it to work, and just really to have a nice environment for people to utilize as they're doing their work. So we're excited about that. I did want to let you know one other building issue that happened very recently. It was last week. We actually had a steam pipe that burst in our building that necessitated us to actually send everybody home and close the department for a day. It caused quite a bit of damage on the basement level, and then actually, even though it's upstairs in our epidemiology suite, it did quite a bit of damage in there, and they're actually still in there working on that. So unfortunately, that is an issue that we had to deal with last week, that hopefully will all be taken care of and repaired here very shortly. Respiratory illnesses continue to increase, so it is definitely the season. We have increases in RSV, influenza for sure, and COVID continues to be out there as well. So we're just continuing to remind our community to take steps to prevent the spread of these illnesses. I'll be doing an interview with one of the local news stations tomorrow evening about respiratory illnesses, so that's coming as well. As Pete shared, we were able to share our CASPER results with City Council, Safety Committee, and also with the National Weather Service in their integrated warning team meeting that happened yesterday. So that went very well. Sounds like they had great attendance and also had a lot of really good questions that came out of that. So I think the community hopefully has even better awareness of kind of the needs that might have come up during an emergency like that. So hopefully we can plan as a community to tighten those gaps in the future. And then last week, we were also able to meet with UNMC to discuss some support around preparedness and response capacity. As you know, with a biocontainment unit in our backyard, that means that on the community side, public health really has to be able to keep up with that work that's happening, and they're continuing to grow. So there is quite a lot that we're going to be seeing coming from them in that space in the coming year or two. And so we want to make sure that on the community side, we are well prepared and have the capacity to respond if we have special pathogens or we have people who are coming in and utilizing the biocontainment or quarantine units. And so we felt like that partnership was really important to continue discussing and hopefully get that capacity built up. So we've just started those conversations, and that seemed to be a good conversation as well. I think that's all of the updates that I have for you. Do you have any questions?
With the respiratory illnesses recently, do you know how they compare to previous years? They sound, at least the media, seems like it's higher or worse than it's been in previous years.
That's a really good question. Can I invite you up, Justin, to talk on that? It might be faster than me trying to pull up the portal and find that data.
So good morning. As far as respiratory illnesses, what we're seeing this year is an increase in influenza the last few weeks of December and into January. About 80% of our cases. The last report that we had about 400 cases reported in 1 week. So is it different than last year? Not necessarily, but we are seeing kind of I would call perfect storm in a sense, where we're not only seeing influenza, but our RSV numbers are up. Our COVID numbers are considerably up. I think in the last 30 days, they were over 200% increase. And in this most recent week, we're still at a 50 plus% increase. So a lot of COVID in the community. We're still seeing pertussis. Pertussis is a big deal. We've had more cases this past year because we do count those on an annual basis, right? So from January to the end of December. But we saw more cases than we've seen in over a decade of pertussis. So a lot of these kind of respiratory illnesses are turning back to pre-pandemic levels, if you will. I also think that our vaccination rates are not as good, or we know they're not as good as pre-pandemic. And so hoping that folks will get the message that the best way to protect themselves is to vaccinate, and then, if they're sick, stay home, cover your cough, all those sort of things, wash your hands. In addition to that, we're seeing pretty significant increases in norovirus. There's actually a new strain of norovirus out there, so the whole country is seeing a lot of GI illness, a lot of cruise ships, things like that. And I think this new strain accounts for over 70% of those outbreaks. So, any other questions about respiratory virus before I sit down? Okay, thank you.
Any other questions for Director? Report? All right, thanks for
All right, thanks so
sharing.
much.
So all the department reports were submitted through the agenda. Is there any questions on those reports? Seeing none. So then let's see, that there's a committee meeting coming up. You want to talk about that, Jeannie?
Yes, I just wanted to remind the board that on the first Friday of February, we have our next admin committee meeting. We'll be bringing forward, we've been working with Change Labs around our legal EPI project, and we will be bringing forward possible policies to pursue around pediatric mental wellness. We've been working hard on the 27th of January, we have an advisory that will look at a broader list and narrow it, and then bring that narrowing list to the board to provide some feedback as we work to narrow it down to 2. So it's just very important that the board is there to help us work through that process. We'd appreciate it. We just completed earlier on January 10th, we had our conversation around the educational equity policies. If there's whatever you can do in order to attend, we greatly appreciate it. And then also I want to put forward and just ask the question of, is there a need to move the date or the time that these committee meetings occur to help promote and greater feasibility to attend?
I was actually going to ask about that. I can't ever do Fridays because I have booked standard weekly meetings. But if that changed, I'd be happy to be involved. Or if, I don't know if there's ways to go through the materials and give input prior to a committee meeting, even if I couldn't be at, or if somebody can't be at the committee meeting, if that would be helpful or not helpful. Either would, just ideas.
Yeah, the Friday morning, excuse me, doesn't work for me either. Unless it'd be helpful if it starts at 8:30, correct?
Correct.
If it could be moved to 8, that would help me, but probably not.
Okay.
So,
Well, we may be sending out some options, day and time options, to see if we can find another time that works better.
All right. You have another question?
I just had a question. Did I miss the foundation report?
Foundation
Update from the health director?
I'm so sorry. You didn't miss it because I didn't do it.
Oh.
At this time, is that better? Yay, okay. At this time, we are just working on really getting the attorney on board and making sure that we're getting the right paperwork done in the right order. So Very much still in the very beginning stages, but definitely moving forward as well. Sorry about that.
All right. So with that said, next Board of Health meeting for February will be on the 19th. It'll be here in the legislative chambers. No need for an executive session, I don't think. So then can I get a motion to adjourn?
Second.
Second?
Wade,
Yes.
McNally, King, Festerson, Jones, Rogers, Espinoza, Wilkin, Weiss.